Good evening all. So we can start the session. Sir, could you please share your screen? Thank you, sir. Good evening all of you once again. And on behalf of Astron E-College, I am Ms. Paulmi Banerjee. Welcome you all on board for the webinar session on prioritizing healthcare business excellence to achieve optimal outcome of government universal health schemes. As you all are aware that Astron Institute of International Studies is a NABIT accredited institute, and we have recently launched Astron E-College under the umbrella of Astron Institute of International Studies. So Astron E-College is an online portal for working professionals, specially catering to healthcare professionals. The courses are pre-recorded video-based sessions of 2 hours, however, could be completed as per students' convenient. And the courses are comprised of various modules and assignments. On completion of the course, you will get globally recognized certificate, which is valid lifetime. Yeah, so we have courses in the various domains, specially focused in healthcare domains, along with soft skill, motivational skill, and banking. So for more information, you can log into www.astronecollege.com. Now I take this opportunity to welcome Mr. M Mathavan sir, who is our honored speaker for the session, and he is Facility Director at Sri Mata Vaishnav Devi Narayana Super Specialty Hospital, Katra, having more than 23 years of experience. He is specialized in healthcare business excellence, healthcare operation, hospital administration, quality, and accreditation. Over to you, sir.
Thank you, Paulmi. Thank you for introducing me. And I would like to add one more thing as such. I am the only guy doing a PhD in Ayushman Bharat in the whole of the country. So it makes a very big thing that I am speaking in this context of how to just optimize the government universal healthcare schemes. So let us just start doing on to it. I am sure that many of the people must have been knowing about Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana. So let us just see that how our flow of presentation will be there. See how the government is trying to push on the universal health scheme, and what are the models adapted by the government, and how they are trying to expand the scheme to cover everyone. And when the scheme is getting expanded, how does the healthcare organizations can control and excel? And see, whenever we are doing the work, we need money to come back to us. So how do you work on the recoveries, and how do we work on the increase in the revenue? And what are the challenges in going ahead with this? So let me just start with my presentation by giving a small introduction. Just see this thing as such. From Niti Aayog. Niti Aayog is basically the organization that plans for whole of India. However, the development, how it has to happen as such. So it is very clearly that it mentions that India is committed to achieving universal healthcare for all by 2030. Which is the fundamental to achieving the other sustainable development goals. See, how does it work onto it? See, presently, this universal health scheme, now it is only covered for, in many states, it is covered only for socially economic underprivileged people, which is hardly very less number of people who don't have an affordability to take healthcare to bring healthcare to them. Only it is covered. But slowly the government has committed to cover for universal to everyone as such, which means every population, either rich, poor, everyone will be covered under this scheme. So hospitals in future will not be will be having very less choice to avoid this scheme. So by Niti Aayog, by 2030, which means hardly we are having some 7 to 8 years left to have everyone covered under it. You might be having one Ayushman card, I might be having one Ayushman card, irrespective of my economic status. But hospital has to work towards this Ayushman card sustainability as such. So the whole presentation will be focusing on this. How do we do it, business excellence based on this universal health scheme? So this is one said by this as such. See, I was just saying that already government has covered almost 3 states with 100% population under Ayushman Bharat. So just for your knowledge, I'll say that Uttarakhand, JNK, and Gujarat, and the next state that is going to come into 100% coverage is the UP. So you must be going through the news continuously. So once if it is 100% coverage, everyone will be having this choice of going with Ayushman Bharat, and government in other sense will be pressurizing the hospitals to take up this Ayushman scheme. And just for your knowledge, just if you see this figure on page, now all the complete military organizations have been covered under Ayushman Bharat, and now government has brought into the CGHS, ECHS, and every central government employees into the Ayushman Bharat. So when we are just saying this Pradhan Mantri Jan Arogya Yojana is getting expanded widely, so we need to have these two concepts very clear with this. What is this? So one is the treatment based on cost and cost based on treatment. So this might be practically synonymically almost same, but it is not same. It has a very deeper meaning into it. So let us go into the first statement, treatment based on cost. What do you understand by this treatment based on cost? So first, if you see that, there is a limited fund. You get admitted for some fever or anything. Government says that for this particular day, for a fever treatment, I'll be paying you only 2,000 rupees. So you have to cover everything from sky to earth, everything you need to cover. When I say sky to earth, so doctor's charges, nursing charges, diagnostics, medicines, food, your biomedical waste, your electricity, your infrastructure cost, your administrative cost, everything needs to be covered under this 2,000 rupees per day for a treatment of fever. So now comes the second statement, cost based on treatment. So when I say that cost based on treatment, first I understand what is the diagnosis I'm going to come up with it. So once the diagnosis comes up, then I just go scientifically to treat the patient with particular antibiotics or particular treatment capacity or particular severity like general ward or ICU on that. So these are the two statements that we need to be very, very deeply understanding before going on. See, all these schemes, universal health coverage, when government has announced, or even CGHS, CCHS, they work on the first statement, treatment based on cost, not cost based on treatment. So hospitals will not have a choice to have enough resources to utilize for the patients. So they have to just utilize these resources within the particular cost. So everything needs to be worked within this particular cost on that. So these are the two deep meanings that before going ahead, we have to learn about this scheme. So let me just move ahead on this. So how do we work on this? How do you work on this? See, whenever there is going to be a change. So just if you see that many people, I'm just seeing that you are students or you might be working with professional organizations. There is something called you just work and just ask for an open money as such. So these are my plans and I wanted so and so budget for it. Secondly, there is something called I give you a budget and you need to work within this budget. So whenever there is that particular constraint comes into it, you start worrying about it. Oh my God, how do I work on it? Now my plan was good. I need to expand more. I need to work more as such. But now I'm given with the limited budget, and within this budget, I have to do all my plannings without compromising the quality. So whenever such change comes, so it is very important to just make sure that your team is getting continuously trained and team is getting motivated, because no one is ready to accept any change that easily. So when a change is going to come, I'm just going to say that you're going to use only such antibiotics. You're going to just restrict your investigations. So you are going to just make sure that within this cost, you are going to make the treatment on. So then, which means your team needs to be continuously trained onto it. They have to be oriented. This is what my constraint is. So you have to move ahead in this. So second, then you keep on continuously providing the challenging targets to the team and building a performance-based culture. So slowly, it might not be that easy that immediately once you give a budget, people will just stick to the budget. It is not possible at all. First thing is your doctors will come and fight with you. How do you just expect me to do this? This patient needs this many cross consultation. This patient needs this many diagnostics. So how do you just expect me to do within this cost? So you need to continuously just build up your team on that. And you have to just continuously inform that this is the change that we are all coming to face into it. So that's why your complete performance should be, your complete culture should be based on the performance. And you're laying out your business plans in great quantitative details, not qualitative or subjective details. I'm continuously saying it, quantitative details. So when we say that, so I have 2,000 rupees per day, so I need to just work out everything within this 2,000 rupees to make myself sustainable, as well as to make sure that patient is getting recovered also. So all business plans needs to be, and every doctor, till this nursing side till the housekeeping, everyone needs to be getting involved to make this plan successful on that. And understanding the market segments that individual hospitals will perform. See, this is very important that I'm just trying to say into it. Initially, if you see that presently, if you see any hospital, they'll think that I can do everything. I can do every surgeries. I can do every diagnosis. I can do every medical treatment on it. See, but when there is a budget, a limited constraint, limited budget to it, so now you have to just understand what are your strengths. So you should be making sure that if my strength is not in this, I should be allowing that patient to go to any other hospital that has that particular strength. Why? See, for example, when there is average length of stay, ALOS, how many of you could understand that one? So we need to keep our average length of stay minimal to make sure that this patient is also getting recovered, as well as our cost is also getting reduced onto it. So if I'm not having an expertise, and if my doctor or anyone is not having an expertise in neurosurgery, so I compel him to do a neurosurgery on that. So what will happen? He will try his best. He will complicate the surgery. So once the surgery is complicated, then this average length of stay of the patient is going to go high, and your cost of treatment is going to go high, which means this program is not going to be sustainable. So that's why you should understand the market segments in which you are going to work and in which specialties you are going to work on that. So then comes the fifth point. So everyone needs to understand this. Not only you yourself, your competitors also need to work in tandem. This collaboration is very important. So that, okay, fine, if I'm not expert in neurosurgery, I give all the patients of neurosurgery to you. I'm an expert in cardiac, and you just give the patients of cardiac to me. And so the market share numbers to be achieved rightly on that. So that this particular specialty you specialize, and then you become more and more sustainable for that. And sixth point, and you need to be continuously doing weekly reviews. Three important parameters. What is business, receivables, and supply chain? See, that's why I'm saying that business means there is a top line. So how much revenue is coming on that? And your receivables. See, once you are done, see, these are all government schemes. Once you are done, you are not going to get a ready cash. You need to keep on following with the governments to get your money on it. Luckily, Pradhan Mantri Jan Arogya Yojana says that within 15 days, if every documentation, everything is right, I'll be paying the money in within 15 days on it. So if it is 15 days, it's quite equivalent to a cash patient, where means you are going to have a hot cash flow in your hand. And last is the supply chain. When I'm saying supply chain, we'll be talking in detail about something called value engineering. So when supply chain is the whatever you stock is the money into it. So you say that when we say, and I'll be talking about some of the words on this. Just when you are not able to understand that, we'll be taking up in the question answer sessions. So every inventory has an inventory days. So for example, I say that my inventory days I'm trying to maintain in 20 days, which means I'm maintaining 20 days of stock. For one day, if my stock value is for 100 rupees, so I'll be storing it for 2000 rupees worth of stock on that. So the more you try to increase the inventory days, the cost of inventory will be going on that. And when we are talking about supply chain, continuous your planning has to be very important on that. So three main things: your top line, your receivables, and your supply chain should be in control. And last is the expenses level is to be monitored by cost-effective cost controls. So this is very important. It is not only in supply, it is into manpower. It is, you have to work in your processes so for example, if my process is going long, which means my cost is going to go high, your time, number of manpower involved, everything just works on that. So these are the initiatives that we have to just work on whenever we are just trying to work on a very sustainable model on that. So now I'm just going to talk about how we do control and excel in this, making this model quite sustainable. So I was talking about in my previous slide about the 3 weekly reviews of 3 important parameters, which is business, receivables, and supply chain. So now I'm just talking about one of the main things is the materials. So the supply chain, your consumables. Consumables, when we are talking about, we need to keep the cost at the low. So when I say keeping the cost at the low, it is not the meaning of reducing the quantity of the items that what we are using. So we are going to work on something called as value engineering or value analysis. So what is value engineering? So let me just tell you an example that everyone can relate with this. So you are having an Android phone and you are having an Apple phone. An Android phone comes at the cost of around 15 to 20,000 and decent Android phone, and an Apple around, I did not say about the cost at this time as such. So, but if you see the purpose of both the things, if you see the purpose of both the things, it would be giving you the same results onto it. So that's why this example of just when your user is going to ask for an Apple phone, you need to convince them that, okay, fine, if the same function is ready to do with an Android phone, why can't I go ahead with it? So this is called as value engineering. So you start substituting with the low cost items without the compromise on the functionality. I'm not talking about the quality. So the quality is going to be the same, the functionality is going to be the same, only the brands and the item that what we are going to use, it is going to get changed. So I have just spoken about the phone, but the same thing, it works on the consumables. So surgical consumables, there are switches, there are injections, there are medicines, there are your gauze pads, everything. There are many things that are getting involved into it. So that's why this value engineering is more important in doing that. So the second thing that we are going to talk about the manpower. So manpower, when we say that in the previous slide itself, I've spoken a lot about the manpower, your team building and team motivation, and continuously you have to be training them. Without training, you can't achieve this very stringent targets like this. So what are this training? How do we work on that? First thing is you define policies for every processes, every diagnosis, and every treatment. And let me say, people, government has already defined at least 80% of the items, 80% of the treatments, how it has to be there, how the protocol has to be there, and what are the tests needs to be done, how the treatment has to be. One simple example I can say is that government has standardized the COVID treatment, and which is circulated all over the country on. So you must have seen that AIMS protocol. Like that, government has just utilized many other diseases, even for lap chole, even for cholecystectomy, hysterectomy, everything, that how to diagnose it, what are the tests that you need into it, the perfect, what are the complications, if the complications are there, how you need to work on that. So that every policies that needs to be trained from top to down on that, particularly from between the doctors, nursing, and diagnostics. So you need to prepare manual for every department. When I say manuals, it is a manual can have different policies. So you can say for surgery, you can say for medicine, you can say for a medicine, you can say that different policies can be with poisoning treatment protocol. You can say fever treatment protocol. You can say dengue treatment protocol. So the manuals need to be defined continuously, and these manuals need to be distributed to everyone. That it has to be an open book, and still now it is an open book. There are many links that I could share with that so that everyone can look into it as well. And these manuals, once distributed, needs to be continuously monitored whether people are following anything other than the protocol. There would be many new medicines that would be coming in. Doctors might be liking to try that one as such, but we need to be just stick with the protocols and stick with the manuals. And these once it is these manuals are done, continuous training, and then after that it's an audits. See, when I'm talking about audits, so once this training is done, whether they are just deviating from the protocol, and if they are deviating, what is the reason for deviation? Kindly mute yourself. We can just have a question answer session at the last. So once these audits are completed, you need to give the feedback to the feedback, and then change the policies again. This whole cycle needs to be repeated. So policies, manuals, continuous monitoring, training, audits, and feedback. The whole cycle needs to be continuously doing for the manpower training. So then only this these particular schemes would be quite successful. So then final is the process. So how do we make the process simpler and monitored by everyone as such? So three main things. One is the quality, which again I'm talking about it. And for a quality, there is a cost that goes into it, and government is ready to reimburse that cost also. I'll be just explaining how the government reimburses this cost for the quality that what we are providing. And second is the digitalization. See, these are why digitalization is very important. Why digitalization is very important? Because if you see, we are going to work in huge volumes. See, till now, only some people would be having the access to this insurance card or Pradhan Mantri Jan Arogya Yojana. So when government is going to say that there is going to be universal health coverage, everyone is going to have this card, and everyone will have an access to this insurance policy, and so it is knowing it. So when I'm talking about digitalization, why it is quite important? Because once this universal health program has been announced onto it, everyone will be having this card, and everyone will be having the access to the insurance scheme as such. So we are going to work in very huge volumes. When you're going to work in huge volumes, it is not very easy to manage everything manually. So it is important to make it completely digitalized so that we can monitor all our processes, starting from medicine indent to the diagnostic indent to the material indent. Everything can be just monitored on one single screen, and it has to. And that's why digitalization is very important in implementing such schemes. And just let me say, gentlemen, this is one of the paperless scheme that government has implemented, and you need not go to submit your papers to the government for getting your money. So everything is digitalized, and starting from GPS tracked photographs are record, including the documents. So we are many of the hospitals are still talking about the electronic medical records, but government has gone one step ahead and just implemented this already for the hospitals which are trying to implement this Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana. So this is what I was talking about, the training and digitalization, and last comes the recovery of the EBITDA plan. What is EBITDA? Earnings before income tax, depreciation, amortization. So this is what every business organization just works out. So if EBITDA in simple terms is a profit. So if you don't have a profit, then why do you work in such a business? So that is more important, that if you're not going to make a profit, it is not going, the program is not going to get sustained, and you're not going to have an expansion program, and you're not, we will not able to move forward on that. So the first thing, how do we just increase our profit margin? Consumption analysis and cost control. I had been continuously talking about this, how much consumption. So for example, in any hospital, if you say 100 rupees that we are going to spend, since we are in a service industry, almost 55% goes into the cost of manpower, and almost 30 to 34% goes to the material cost, and remaining goes into the marketing, maintenance, and everything onto it. And in that, you need to say 100 rupees, you say that, okay, fine, I'm having a target of saving at least 5% margin onto it. Any corporate hospital has a margin range from 18% to almost 30% based on different things. But when this scheme is going to come, it's going to be universally covered for everyone. So which means the margins are going to be quite less. And we, in spite of it, we need to, but we are going to work in the volumes. So first thing is we need to work on the consumption analysis. So if you say that our target consumption is going to be 30 to 34%, just we need to make sure that it is maintained within that. There are many plans to make sure this consumption can be kept under control. There is a complete schedule on inventory management and inventory control management. So starting from purchase to disposal, every process needs to be controlled. So we simply call it as cradle to grave concept. Cradle to grave concept is just starting from procurement of the material till the disposal of the material. The process needs to be completely monitored, and the cost needs to be kept in control. And second is the change in revenue payer mix. See why this is this we are going to talk about is presently any hospital, any good hospital in a city will be having almost 60% as a cash business and 40% as a credit business. When I say a credit business, it is your money is going to come after some 30 days or 60 days. So that is called as a credit business. Different insurance companies that we work with this. So, but once this universal health program is going to get implemented, so change in revenue payer mix is going to happen. Hardly some 10 to 15% will be cash patients. Around 85% would be only credit patients on. And this model, this particular change we are seeing in many hospitals where this 100% universal health program has been implemented, particularly in J&K and Uttarakhand. And we need to increase the volume to absorb the fixed cost. So just let me just put in a simple example. You have a many of you are students here. So tell, for example, a college appoints a teacher. So when a teacher says a salary of around 1 lakh, a salary of 1 lakh is shared between 10 students. But within 10 students, one student is absorbing a cost of almost 10,000. But if the same thing that we are going to make with 100 students, so how much is the cost per student? It goes for hardly with 1,000 rupees per student on that. So that's the reason that increase in volume needs to be done to absorb the fixed cost. So only the recurring cost, that are variable cost, will be little higher on that, but the fixed cost will be going down day by day when you increase the volumes. And finally, attractive pricing and promotional packages. See, when I'm talking about this, I'm particularly talking about the preventive healthcare plans. See, whenever a patient is not doing a preventive health checkup, he ultimately finds that one day he has come with a heart attack and his length of stay is going to be very high on it. But if the same patient works on preventive healthcare, he can be quite cautious and he can make sure that this he can anticipate that his heart attack is going to be there. He can prevent the heart attack on that. So you just encourage the patients to go for preventive health checkup. So you need to have a good attractive pricing and a promotional package so that patients do not end up in the hospital, instead of that they do a preventive health checkup on that. And see, this whole program is completely digitalized. So fifth one is the minimization of the billing errors to reduce the disallowances. See, these programs are quite stringent. There might be a small mistake of any small billing error, the whole bill gets rejected. You must have just treated the patient for 5 days for a cost of around some 1.5 lakhs, but one small billing error might just make sure that your 1.5 lakhs is completely gone. The patient has also been discharged. Government is not going to give you money. So which means your staff, your billing staff, and not only this, your doctors and nurses, your billing staff, your recovery staff, everyone needs to be highly trained to make sure that errorless billing is done on it. And maximum utilization of resources before replacement. So when I'm just talking about this, I'm talking about the reuses. A simple example I can say is this dialysis. Many of them would be in many of them would be as a dialysis technicians. So if you see that a dialysis, there are single-use dialysis that come most often, and patients always prefer that I need a single-use dialyzer only. But if you see the protocols, and the medicine protocols always allows a dialyzer to reuse till at least 7 to 8 times based on this functionality. So which means you need to encourage your staff to reuse for a single patient, not reuse in the sense not for the different patients, but reuse for a single patient continuously, and then reduce the cost on that. So maximum utilization of resources before the replacement. So this is what and challenge to maintain own cash flow. So when I say challenge to maintain own cash flow, it is the recoveries. So if you just submit the billing on time, which means your money is going to come very early. If your billing is, and government says very clearly, if you don't submit within a week, I'm not going to pass your bills. So which means your billing, everyone has to be quite smart enough to just submit the bill within a week so that your money comes within 15 days. If the billing is not submitted, your money is not going to come. And if you're just asking for the government, just okay, fine, please kindly waive off the timeline, then your money is going to come delayed and your cash flow is going to get delayed onto it. See, cash flow is very important in any organization. Without a cash flow, you will not be able to pay your salaries. You will not be able to pay your vendors. When you don't pay your vendors, then your material supply will be coming delayed, and you will not be able to treat the patients. And without the salaries, definitely I will not say anything. No one is ready to go, is going to work on it. This complete cycle needs to be maintained. So your billing has to be submitted in time, and your recovery has to come in time, so that the cash flow is completely positive. Cash flow is always maintained on that. So this already we had talked about the quality, digitalization, and the recoveries. And see, government also has given option to increase the revenue. For example, you are getting you're getting 100 rupees for a particular surgery on them. Government says that you go ahead with an NABH. So this is actually the item has moved. NABH, government gives 15% increment. For example, you will, for a normal hospital with an NABH, without an NABH, will be getting 100 rupees. But if you're an NABH or any other quality accreditation, you will be getting 115 rupees. Sorry for that, this one has just moved in front, so it is showing us 5%. It is actually 15%. So if you do an NABH, it will get 15%. So, and second thing is, when you're going to work in huge volumes, you have you can just apply for the DNB programs. DNB programs or nursing colleges and everything, you can just apply to that. So once government recognizes you as a teaching college, then there is one more 10% that is getting increased on it. So instead of 100 rupees, if you're having an NABH and any teaching program of critical care or anesthesia or anything, that you will be getting 125%, 125 rupees you will be getting instead of 100 rupees. And then, and government again just encourages, since it is going to be a universal health program, government encourages just to make sure that this program or this more hospitals to be coming in the rural setups. If you see, many of the big hospitals or good hospitals are only in the cities. So government says that just if you just start up a hospital in a rural setup, I'll be giving you one more 15% higher assessment. So which means for a treatment that you are going to get only 100 rupees. So if you are having an NABH, you are having a DNB, and you are in a rural, so you are going to get almost 40% extra. So it is 140 rupees you will be getting extra. So government is helping you to increase the revenue. Also, it is encouraging you to give quality. It is encouraging you to teach or bring up new capacity building, and it is encouraging you to go into the rural setups also, where not many people are ready to go into that. So these are some advantages of this scheme on that. So finally, see, before talking into challenges, just let me just explain. There are something called in any management, there are something called internal factors and external factors. Internal factors are something that you can control. So your manpower cost, your consumption cost, these are all internal factors. When we say in external factors, it is a government policies. You don't have any control over the government policies. So something this government has already said that I'm going to implement this universal health program by 2030, 100% in all the states. In all the states, when they say it as such, which means it's an external factor, you don't have a choice. You need to just adapt to it, and you need to adjust your internal working based on this external influence on it. There is a war, there is a inflation, everything is external, which you don't have any control over it. So this government has said this policy is going to be universal, you don't have a control over it, so you need to adapt on that. So there are some challenges whenever we implement such huge change. And these all policies has been adapted, well thought about, and has been adapted from different models. Just if you see my first slide, I have just shown some figures on this. So what it is NHS UK. UK is United Kingdom, London, and all other European countries, where NHS Trust, National Health Services, it's a trust made that so that they have implemented for all their population. And this government has adapted this model. When developed countries can work on this model, why not India cannot work in this model? So that's why this NHS. And then in India, even before this scheme was implemented, Telangana and Andhra Pradesh had already worked in a scheme named Arogyasri. In Arogyasri, they have made sure that every hospital should allot 20% of their beds to the poor people, and for this particular scheme. And government has defined the same thing. What would be the cost of the treatment? What is the protocol of the treatment? What is the quality that you are going to give in this treatment? And it has very clearly defined on that. Based on that, government has adapted this Pradhan Mantri Jan Arogya Yojana, and which is simply called as Ayushman Bharat. And challenges. This is very important that I'm just trying to talk about it as such. See, there are something that we need to work on it. So I was just talking in our first slide, treatment based on cost and cost based on treatment. So when it is going to be the treatment based on cost, so your quality of healthcare in terms of treatment, which means cross consultations and diagnostics, will be minimized. A patient might be having a multiple diagnosis. He might be a heart patient also, he might be a dialysis patient also, he might be requiring a chest consultation also. But in Ayushman Bharat, there is a disadvantage. One admission, one diagnosis, and one doctor. So that's an issue on it. But when you try to just take up a different or cross consultation, the cost of treatment is going to go up high, and it is not sustainable for the hospitals. So that's why this is one of the biggest challenge on it. And secondly, and mostly hospitals will be saying that if the treatment protocol is going to be the same, I need to just, because this is going to be the money that I'm going to get for all patients. So what they will do, they will not invest in any different private wards or any high-end wards on that. They will be trying to invest mostly on the general wards, which means if you want to have a luxury treatment, that affordability is going to go less on this particular scheme. And third thing is the lower ARPOB, ARPOB, average revenue per occupied bed. See, in any corporate hospital, a good corporate hospital with all ethical practices, any single bed can earn around some 1 crore per bed for a year. But when this scheme is going to get implemented, then you will be hardly having almost 60 lakhs per year per bed as such. and which is going to be very less on that, which means your occupancy should be quite high. When I'm talking about volumes continuously, your volume should be quite high to make sure this is going to be sustainable. When the RPOB is going to be low, your margin, the amount of margin, not the percentage, the amount of margin is going to be low. So this is, so many hospitals will be thinking that when initially I was getting a quite good profit margin of 30% or something, now I'm going to get only some 5% or 6%. So many hospitals will not be trying to expand bigger on that. So now the last one is the restriction on high-end advanced technology. So I'll be thinking that, okay, fine, I'll just talk about the MRI. MRI is measured through Teslas. It starts from 0.5 Tesla to 2 Tesla to 3 Teslas, 1.5 Tesla, 2 Tesla, and 3 Tesla. The more the amount of Tesla that goes up, the cost is going to be higher. When the Tesla is going to be higher, then the precision of your diagnosis is going to be higher on that. For example, in 1.5 Tesla might be costing around some 8 crores, and the same 2 Tesla might be costing around some 12 crores. The hospital will be trying to, the new hospitals will be trying not to invest in bigger technologies. So when I'm going to get the same money for a 0.5 Tesla also, when I'm going to get the same money for a 1.5 Tesla, so why should I go for a 1.5 Tesla? I'll be just working on a 0.5 Tesla itself. Might be the images might be a little blurred, or my manpower needs to work a little more on that, so that they will be trying to restrict on the high advanced technology. You're talking about robotics, people will not be not investing in robotics. You're talking about some harmonic scalpels and everything, people will not be investing on it, because the treatment is, the cost is going to be the same, irrespective of any advanced technology that you're going to use on that. So people will be start thinking about the refurbished machines, which is going to be quite low on that as such. And this cycle will lead to, practically may lead to, I'm not saying that will lead to, it may lead to the destruction of the healthcare. How come? See, if you see just before a week, if how many of you have been following up the newspapers, I don't know. So if you see before a week, government has announced that 50% of their DNB seats or the postgraduate seats have gone vacant in medical line. I think so many of them would be aware about it. Why it is? Because hospitals have started paying less. Doctors, when they are doing a postgraduate, they expect a higher pay. And if the doctors are not, if the doctors are not going to pay the higher pay, they will not try to take up the advanced courses. So which means the whole cycle. So the hospitals are not going to invest big on that. And then if the hospitals are not going to invest big, the healthcare professionals are not going to come into this field continuously. So it's a complete cycle that will get diminished on this. So these are some challenges. But overall, if you see that every scheme has an positivity as well as every pros and cons are there. The positivity is that almost every people are covered for the health programs. But at the same time, but the hospitals, which are the providers, healthcare providers, they will be in a little disadvantage. But this change needs to be adapted. There is no choice if you are to sustain in this industry. So, but see everyone. I'm having almost 23 years of experience, and I'm doing a PhD particularly in this program on that. But not everyone will have a chance to do this or understand this. But Astron, if you see that Astron through its online learning has introduced this particular course, how to excel in business when that you are getting adapted to external changes and trying to adapt yourself on that. Just this particular course, I'm talking about building business excellence in healthcare skilling programs. See, it's a very good program that it will help you to understand my 23 years of experience in hardly some 3 years. Might be my experience, you can understand my experience, but it will be needing more expertise that when I'm just continuously doing this, I would have come to this particular expertise level. This program, Astran had introduced at around 2,500 rupees, but it is providing a concession of around some, Polemi, can you just pull in how much is the concession that you are just providing for this scheme, for this particular course?
Sir, so we are giving a 70% discount on the course fees, sir. So after discount, it is 699.
Yeah, see, absolutely, it's a very big golden chance. You can get people like me to get interacted, and you can see that anything that external factors that you get adapted very easily. See, my 23 years of experience, Kandat, if I'm speaking in half an hour or 1 hour, there will be very less chance for some people to hear about it. Astron is giving this chance to take up this program. Kindly go ahead with this. So just after saying this, let me just conclude this. Thank you for attending. And there had been disturbances in between. And thank you for Astron Institute for providing me a chance to speak about this particular program. Because since it is going to this might be a very early time to speak about it, but after 2 years you will be seeing this program everywhere. So at the time you might be realizing, oh God, okay, I should have listened to this particular thing. So thank you. Just over to you, Polami. Any queries, anything? I'm open for it. So just however you can moderate, I'm ready to take it up.
Yeah. Thank you so much, sir. We learned a lot, sir. Thank you so much. It's our pleasure to hear you, sir. It's always our pleasure to hear you.
Thank you,
So,
Polami.
yeah. So do you have any queries? So we are open to share your view, and sir can answer your question also. Anyone? Roshan, you want to add something?
Okay. I think so. They are just understood a lot.
So, sir, Roshan, I want to add about him. Roshan, he is from UAE, and he did our course in medical record technician. It was 1-year diploma course. Now he got promoted there, and actually, congratulations to Roshan. Roshan,
congrats, Roshan. Very good, very good.
Yeah, Roshan, can you hear me? I think.
Yeah. I'm hearing you. Thank you so much.
Good.
Yeah.
So keep on developing your skills, Roshan. It is not that one that since you are in medical records. See, I can say something that one of my previous colleague who was only medical record technician, not I'm saying only, but he has become as an unit head, and he's managing a business of 100 crores per year. It's a very big achievement, and he was continuously learning through this online courses. At the age of 35, he was a head of a very huge unit. So never just stop learning, Roshan. Just don't be content that you have got one degree on that. Continuously keep learning it, that you can just move up the ladder a lot.
Yeah, sure, sir.
So I think no queries from the student answer. So we can wind up, sir.
Thank you.
Yeah,
Take care.
Thank you so much, sir.
Thank you.
Thank you, students. Thank you.
Thank you.